Hello, everyone. Today we are joined by Minister Nick Jones, Minister Nixon, Minister LaGrange, Holly Mackin from the Acute Care Alberta, Dr. Peter Jamieson from Alberta Health Services, and Dr. Vivian Sutrop, Chief Medical Officer of Health, here to discuss acute care capacity and respiratory virus season. With that, we will start the press conference and we will hand it off to Minister LaGrange to start. Minister, please go ahead.
Thank you very much, Kyle, and good morning to everyone. As Minister of Primary and Preventative Health Services, protecting the health of Albertans is a central part of my role. Public health affects all of us, and strong leadership is essential to guide our province through both everyday health matters and emerging challenges. That is why we took the search for our new Chief Medical Officer of Health very seriously. We were looking for someone with the right education and experience, but also the judgment and dedication to respond to new and evolving public health situations. But before I go further, I want to sincerely thank Dr. Sunil Sukram for his service as Interim Chief Medical Officer of Health and to wish him all the very best as he returns to his role within our department. After an extensive search, I am very pleased to introduce Dr. Vivian Sutor as Alberta's new Chief Medical Officer of Health. Dr. Sutor brings with her more than 25 years of experience in public health and preventative medicine. And for the past 17 years, she has served as the lead medical officer of health for Alberta's South Zone. Most recently, she led on-the-ground efforts to contain measles in southern Alberta through awareness, education, and immunization. She has also been recognized for her exceptional work teaching and mentoring public health students and helping train the next generation of professionals in our province. Dr. Sutar is very much on the front lines of public health, and I am confident she will continue to promote and protect the health of all Albertans in her new role. And as we head into the holiday season, I also want to briefly touch on what we're seeing with respiratory illnesses within Alberta. Influenza activity is increasing, with confirmed cases more than doubling since late November. This year's flu season is somewhat unusual, as circulating strains are not an exact match for this year's vaccine, which may mean that more people will experience illness. That said, immunization still plays an important role in reducing the risk of severe outcomes, particularly for young children and those that are at higher risk. Influenza immunization is universal and free to all, just like last year. It is available at many pharmacies, community clinics, and through primary care providers right across the province, with walk-in appointments widely offered. And if you have questions about your eligibility or where to go, please reach out to your trusted primary care provider or call 811. And the broader respiratory picture is encouraging. COVID-19 and RSV activity remains significantly lower than in previous years. COVID-19 hospital admissions so far this season are only a fraction of what they have been in the past, and RSV is increasing in line with normal seasonal patterns, with admissions currently lower than at this point last year. While it remains early in the season, overall these trends are within expected ranges. And finally, I want to remind all Albertans that not every flu case requires a trip to the emergency department. Care options do include community urgent care centers and pharmacies, primary care providers, and virtual care services, which will also help ensure that emergency services remain available for those who need them most. So if you don't need to go to the emergency room, please do not go. To protect yourselves and others, please stay home if you are unwell, wash your hands regularly, cover coughs and sneezes, and consider getting immunized. It's not too late to get protected. Please consider taking steps now to keep yourself and others healthy this season. And with that, I will turn it over to Minister Nixon.
Well, thank you. Good morning, everybody. Thank you for that, Minister LaGrange. Part of the healthcare refocusing in Alberta is focusing on making sure that hospitals are not the only resource for Albertans who need care, that instead they're dedicated to Albertans who need acute care, and other sources of care are available for Albertans who don't. All of the health ministers are very focused on that goal and working towards it together. As Minister of Assisted Living Alberta, my role is to help build a robust assisted living system so people can receive non-acute care that they need outside of the hospital. That means making sure hospitals and emergency rooms aren't the default, and that Albertans have real, accessible options in their homes and communities. It also means ensuring that when someone no longer needs acute care, they can move smoothly out of the hospital and into the right care and supports in their community. Think of your grandparents who go to a hospital for a hip replacement. They certainly do need acute care for surgery and for a period of time afterwards. But eventually, when they're focused on rehab, to make sure that new hip works, that care is often best delivered at home and or in their community. When that happens, everyone benefits. Patients recover in the right settings with the right supports, and hospital beds open up for the next Albertans who need them for acute care. Since its creation, Assisted Living Alberta has been focused on exactly this work, helping non-acute patients transition out of hospitals and preserving acute care capacity. This work is critically important during peak periods like respiratory virus season, when hospital capacity matters most. We're doing this by supporting aging in place, helping people to stay in their houses and homes and communities longer with the right home care, caregiver supports, and everyday services that help folks live and age well. We're also connecting patients to the right care, making sure that when someone is ready to leave the hospital, they move smoothly into the supports that fit their needs instead of waiting in a hospital bed that they no longer need. And we're improving navigation in emergency departments by bringing in 24-hour a day, 7-day a week social work support in emergency rooms across the province, so people can be connected directly to community supports instead of defaulting to admission in the hospital when not needed, cutting down on wait times. We're also increasing capacity in the assisted living system so people can transition out of the hospital and into continuing care without delay. Hundreds of new units have come on board in Alberta in the last few months. Thousands are under construction. And over the next decade, we've committed in our province billions of dollars to build tens of thousands of new continuing care spaces across the province, the largest continuing care expansion in Alberta's history. As a result of all this, we've already reduced the number of non-acute patients in hospital by 20% across the province. That's freed up hundreds of beds. It's actually the equivalent of adding the new Red Deer Hospital expansion back into the system alone, just on that reduction. And with that said, I will turn it over to Minister Jones to tell you what he's doing with those beds and elsewhere in the system.
Thank you, Minister Nixon, and thank you to everyone for joining us today. We're here because supporting Albertans through respiratory virus season takes teamwork and collaboration across the healthcare system. And we want to share how our system is responding to the increased demand that we are seeing this winter and what we're doing to make sure that care remains accessible for everyone who needs it. Hospitals, as you know, particularly in the Calgary and Edmonton area, are experiencing higher demand due to an increase in respiratory illness, most notably influenza A. These seasonal pressures are expected, and our system plans ahead every year to ensure care is available when Albertans need it. Despite these pressures, emergency departments remain open. Surgeries are continuing, and teams across the system are doing incredible work to keep services running safely and smoothly. To ensure sufficient capacity, 336 hospital beds have been designated for respiratory virus season, and of these, 206 beds are now available year-round. 130 surge beds added during peak periods. There is strong province-wide coordination among Acute Care Alberta, AHS, Covenant Health, and other system partners to manage patient flow and to deploy resources effectively to maintain service and care across the province. At present, we are opening surge beds, maximizing available space, expanding virtual care, and safely discharging patients while limiting transfers to high-pressure areas and continuing to recruit and add staff. Should demand continue to rise, we are prepared to open additional surge capacity and further accelerate patient flow safely. We are also continuing to expand community programs and virtual care with a clear focus on ensuring Albertans still receive the care they need, even when our system is under pressure. Our government has taken important steps to build additional acute care capacity. This includes the Acute Care Action Plan's commitment to add over 1,000 acute care beds in Edmonton and Calgary, the $1.8 billion redevelopment of the Red Deer Regional Hospital, which will add 200 beds,
the announcement of the standalone stollery, which would add another 100 beds, and the construction of 8 new urgent care centers across Alberta. We're also making significant progress on growing and strengthening our healthcare workforce. We achieved a record 13,674 physicians just this year and expanded medical school training to produce even more. And we've also achieved 51,000 nurses, which is a 33% increase over 2019. In hospital, we are making strong progress, as Minister Nixon noted, moving alternate level of care patients, or ALCs, who no longer require acute care into more appropriate settings. This frees up hospital beds. And Minister Nixon and his team are embarking on one of the largest builds of continuing care in Alberta's history. Keeping Albertans safe, especially those most vulnerable to respiratory illness, remains our top priority. We encourage everyone to stay up to date on immunizations, to stay home when sick, and to choose the right level of care to meet their needs. HealthLink 811 is available 24/7 to provide trusted health advice, and of course, people can contact their family physicians. We are monitoring the situation closely, adapting as required, and making sure our health system stays strong and responsive. I'd like to thank all the healthcare professionals for their dedication, professionalism, and tireless work caring for Albertans, and we encourage Albertans to take simple steps to stay healthy and help protect each other as we move through this season together. I would now like to invite Holly Mackin, Executive Lead of Acute Care Service Delivery with Acute Care Alberta, to provide an update on the current respiratory virus situation and the outlook for the weeks ahead. Thank you.
Thank you, Minister Jones. We appreciate the leadership and support you and your team are providing. Acute Care Alberta is working directly with Alberta's full network of hospitals, tertiary centers, urgent care centers, continuing care providers, and emergency health services to address the increasing and significant demands being experienced across the healthcare system. Our unique provincial perspective at Acute Care Alberta allows us to direct collaborative action quickly. Our team has proactively led provincial surge planning, and we continue to work closely with our partners and providers. The response is now fully activated system-wide. This is an ongoing collaboration. We receive updates from our providers regularly throughout the day. Updates include detail on patient flow, bed and space availability, and staffing in response to demand. Our dedicated team is providing support for coordination of resources with all our providers across the province. Where clinically appropriate, we are expediting patient discharge for those who no longer require acute care services. These decisions are made with patient safety first, and only those who can go home with appropriate out-of-hospital supports are discharged. Our continuing care and community partners are working hard to maximize the capacity in the system outside of acute care, including expediting transitions for those waiting for placement. Where needed, transfers between facilities are happening to balance demand, and our staff are being supported from Frontline and beyond. We are nimble in our support to empower site-level decisions to optimize care across the system. Be assured, Alberta's system will continue to adapt to the conditions we are facing. You and your families remain our priority. To speak more to frontline conditions and the operational surge response, I will ask Dr. Peter Jameson to come forward now and please speak.
Thanks very much, Holly, and good morning, everybody. Thank you, ministers, for the opportunity to address some aspects from the point of view of Alberta Health Services. So I'm coming to you today from the site of my clinical practice at the Foothills Medical Centre in Calgary, where we are definitely seeing an increase in patient volumes related to influenza in particular. But this isn't unique to where I work. It's common across the province, and in fact, it's common across the Northern Hemisphere. All around the country, we're seeing surges in demand related to respiratory viruses connected to the cold weather and people staying indoors, and that means that our emergency departments are exceptionally busy. I want to assure Albertans that we are doing everything we can to see patients quickly and to say, if you need to come to emergency, we are here for you, and it is safe and appropriate that you come. However, as Minister LaGrange pointed out, emergency is not always the right place. There are multiple other options to remind ourselves of. HealthLink and 811 are available anytime. And I'd also like to highlight the work that our teams have done on the AHS Health Education and Learning website for trusted advice from our pediatric emergency department specialists. If you Google HEAL Alberta, spelled just the way you would think, HEAL Alberta, you'll get a hit that shows you a wide variety of information about how to respond to common pediatric conditions, which we hope will be helpful to families in managing the seasonal illnesses that we all face at this time of year. More specific to things we're doing within AHS to help adjust to the pressure. Whenever we see the surge in demand, we adjust how we operate, and Minister Jones has already given you the numbers of the 336 additional beds that have been pressed into service. To staff those 336 beds requires significant effort and commitment from our teams, and I want to thank the nurses and the allied health professionals and the physicians who are staffing those additional beds. It makes a big difference, and it's a really important part of our response. However, we also do many other things to ensure that we use every bed to its best possible potential. We're using some overcapacity spaces. We're load leveling to make sure any available bed is used. So if one site is busier, we can shift suitable patients to care at a different site so that we minimize the load on each emergency department. And that includes repatriating patients quickly back to their home communities. And this time of year in particular, patients would rather be close to home and close to families. And so that's an important focus for us. We work every day to ensure that we keep patients for as little time as possible in the hospital. Nobody really wants to be in hospital. If they need to be there, we're happy to provide the care, but we're working on extending hours of short stay units, day medicine units, and creating discharge spaces or designated discharge spaces to make sure that the time people spend in hospital is used as well as possible, and so that those spaces become available to clear out the emergency departments as soon as possible. And then finally, I just want to thank all Albertans for the things that you're all doing to help us in terms of using and preserving hospital capacity. As already mentioned, covering coughs and sneezes, washing your hands regularly, staying home when sick, and particularly not visiting loved ones or friends in hospital. When you're ill, I know that there's a real drive to be together over the holidays, and of course it's difficult when a family member is in hospital. But if you're unwell, we would really ask you to stay home or consider other options like virtual visits, which our team would be very pleased to support. And of course, as already said multiple times, it is not too late to be immunized. There is significant benefit, even though the vaccine isn't a perfect match this year. It definitely offers you the opportunity to protect yourself from severe illness if you do become infected. And in particular, it offers you the chance to extend that benefit to your friends and colleagues who might be immunosuppressed or have other reasons why it's hard for them to fight off the flu. So thank you for the chance to give those comments, and I'll pass it back to the team.
Thank you, Dr. Jameson. That brings us to the end of the speaking portion of our news conference. Now we'll move to the media question and answer portion. We will have time for one question and one follow-up. I'd just like to ask the media to identify yourself, your outlet, and let us know to whom you're directing your question. And we're going to start with Lisa Johnson.
Hi, thanks for taking my question. This is for Dr. Sudorp. Congratulations on the new role. Thanks for making yourself available. I'm wondering, I have to ask a broad-based questions here that like I think a lot of people are wondering. Your predecessor, Dr. Hinshaw, was villainized, ostracized, and at a certain point blackballed from working for Alberta Health Services. What made you want to take on this role, and are you aware of the pitfalls of taking on this position?
Thank you, Lisa, for that question. A number of things that swayed me into applying for this position. First and foremost is I had the opportunity and the privilege to be an interim deputy chief medical officer of health in the last 6 months. It allowed me to work with many amazing teams within the public health division and across ministries, and also with teams across the province. And I see the passion, the leadership, and the opportunities. The second point is this is a unique time in Alberta. My background in family medicine as well as in public health, I believe would be valuable in the current refocusing system of healthcare. When I see how public health is actually woven into the primary care framework, this is a unique opportunity where we can integrate and collaborate with all the health agencies, and especially with primary care, so that public health programming is woven into primary care programs.
Thank you, Lisa. Thank you, Dr. Suttrup. Lisa, do you have another follow-up?
Yeah, thank you for that. I really appreciate you taking questions. I guess I'm just wondering, are you worried about being scapegoated by this government if things don't go well in the public health sphere?
So I see again that public health. One of my mottos is that everybody owns public health. So I think, as was discussed today, there are responsibilities of every individual, every family, every school, every faith-based organization, every community organization, all of us around trying to improve the health of individuals and communities and overall populations. So I see that together we can improve the health of all Albertans.
If I could just add to that, this is Minister LaGrange. I'm really looking forward to working with Dr. Vivian and, developing a really strong public health system right across Alberta. So I'm excited about the possibilities as we've restructured and refocused healthcare in Alberta, that we're entering into a new era. And this is, as Dr. Vivian Sutter has said, it's an opportunity to really strengthen public health within our province. So excited to do that work.
Thank you. We will now move to Yves Cote.
Hi, can you hear me? Yeah. Okay. My first question is a little unrelated. It's for Minister Lagrange. I just wanted to hear you on the court's decision yesterday to lift the injunction on Bill 26 in the Égal Canada. What this mean for the government, and also does this mean that the Bill 26 is enacted as of yesterday?
Well, I just heard of that decision, so I'm going to have my department dig into it and find out what that actually does mean for us. So it's a little bit too early to share my thoughts on it, but I will be able to share that some thoughts on it more broadly once I get that assessment by my department.
Great. Second question is regarding today's announcement. I'm just wondering about the timing of this announcement, as the system is already pretty strained. Why not tackle this earlier in the season?
We've been tackling respiratory virus season. From the very beginning, we have had a very strong public campaign. We've spent over $500,000 already on that campaign. We're going to continue to make sure that we get the news out. We are seeing an increase in influenza, as has been said by numerous of the ministers and officials today. We do see that the vaccine is not a good match for the current strains that are out there. And so we wanted just to remind everybody as we go into the Christmas season, and I do want to wish everyone a Merry Christmas while I have the opportunity. As you go into that Christmas season, you're visiting more and you're interacting more and you're in larger groups, just to remember that the flu is there. It's very real. And in fact, it can actually be a very severe reaction this year because of the strain that is prevalent. That being said, as I said earlier, we are seeing much lower numbers of COVID and RSV, which is a very positive. But again, we have a healthcare system that is under strain, particularly our acute care system. And I want to make sure that, and we all want to make sure that everyone stays happy, healthy throughout this time period, and that we keep our healthcare system in good stead as we enter into this kind of challenging time.
And I'd like to add, Minister Jones here, we started planning for this. The system always plans for respiratory virus season. We did make the decision this summer to make some of our surge response beds permanent. So of those 336 beds that used to be turned on and off, we decided in the summer to make 206 of those permanent. So they were already in place. And then we also have the additional 130 that we operate starting in October. So we did have the highest capacity, I think, ever in preparation for this season. And then I'd like to highlight Minister Nixon's team has been moving alternate level of care patients out of hospitals for months now. And really, every patient that is moved to a more appropriate care setting frees up a hospital bed. So, in addition to the great work that AHS and other providers do every year to prepare for respiratory virus season, we did stand up additional beds and we did move patients to continuing care in other settings to free up capacity in advance of this season. Thank you.
Thank you, ministers. We will now move to Sarah Reed.
Hello, are you able to hear me?
We Yes.
are. Okay. Perfect. I was just curious, maybe this is a question for Dr. Jamieson, but you're talking a lot about alternative levels of care, other options for people, HealthLink 811. I guess sort of what is your advice to people as to, you're saying this flu season is quite severe. What's your advice to people as to when they should be going to the hospital as opposed to when they should be seeking alternate care?
Yeah, thanks. It's a great question. So in some cases, it's very clear that you've got a minor sniffle and you'll be able to tough it out at home. And in some cases, it's very clear that you're feeling lightheaded, dizzy, unable to conduct your usual activities, severe cough or shortness of breath or pain in the chest. Those are all reasons I think most people would recognize they need to seek emergency care. And we are here for you if you do. But then there's also many sort of gray area or in between cases. And that's really why we have 811. And it's why we have the Heal Alberta website. It's why your family physicians provide access to after hours care or your nurse practitioner. So I guess my advice would be if you're not sure, seek our help. We're here to advise you. We have very senior, very well trained nurses working the lines at 811 who have years of experience in helping people with influenza and influenza-like illness, and they would be happy to chat through things with you.
Thanks. And then I guess just in terms of how long we're kind of expecting this, I know that the additional surge capacity was kind of opened in October. I know that in Australia we saw a really bad flu season. How long are you kind of expecting this flu season to carry on for? Do we think it's going to get better, or do we think it's just going to sort of get worse before it gets better?
So the folks who do the modeling for us would tell us that we are possibly past the peak in Calgary. We'll see. But possibly not in northern Alberta. Dr. Suttrup could probably add to that. But the usual pattern is that things do peak around the holidays or early in the new year, and then we have a gradual tailing off. Minister Jones has already indicated that of the 336 beds that we've opened, we plan on keeping 206 of them permanently. And the 130 seasonal beds we will address based on the demand that's needed. So we have some operational flexibility, and we're deploying it as best we can based on the current environment. I've been looking after patients in hospitals in Alberta for 30 years, and some seasons are very bad, some are easier. This one is looking a little worse than usual from an influenza point of view, but it's less severe from a COVID and an RSV point of view, as previously pointed out. So we have some flexibility to respond.
Thank you, Dr. Jamieson. We will now move to Mark Billman.
Kyle, I'd just like to supplement Minister Jones here. The modeling that Dr. Jamieson's referring to would point to December 21st as being the peak for influenza, and then a later peak for RSV in early January, around January 11th. And then the hospitalizations would typically lag that by approximately a week. So if we get to early or mid-January, based on the information we have today, provided the forecasting holds up, that would be when we would be through the lion's share of the pressure.
Thanks, Minister. We'll move to Mark now.
Oh, hi there. Can you hear me?
Yes, we can.
Hi there. Yeah, Mark Filani with CTV Calgary. Yeah, just a question about the bed capacity here in Alberta. We're hearing from some frontline doctors that are saying that they're seeing the highest volume seasons here. They're holding admitted inpatients that can't be admitted into the hospitals because there's no beds. Patients with respiratory viruses are ending up in beds that are also needed by surgery patients that need cancer treatment, for example. That's leading to delays. I know we're looking to add beds and solve this issue, but I guess how do you respond to those claims by other doctors that are seeing this on the front lines?
Who's your question for, Mark?
We'll go with Matt Jones and Adriana LaGrange. Yeah.
Thanks.
Yeah, thank you. So our emergency departments are under pressure, but it's important to note that they do have they are dynamic and they do add additional beds and staffing resourcing as required, which is exactly what's happening. We also load level between facilities, and we also manage traffic between our zones or corridors so that we reduce inbound traffic to high pressure areas, which historically has been Edmonton, now Edmonton and Calgary with the influenza wave. And maybe I'd ask Dr. Jameson to comment further.
Yeah, those are very accurate comments. In times of stress, what do we do to help the emergency department? We open over complement spaces. We load level quite aggressively. We repatriate patients closer to home. We extend hours of stay in short stay and day medicine areas. We can keep people up till midnight some nights so that they don't require admission to hospital at all. And we create designated discharge spaces so that there's somewhere for people to go so they can free up a bed for the next patient. If you think about it, every day has 24 hours. If I can move a patient out of their inpatient bed 1 hour earlier, and I can do that across the hospital, I can free up 3 or 4 beds just by doing it that way. So a lot of it is operational efficiency and being on the ball operationally, and our teams are highly attuned to the need to do that. And the other comment I would say is through fortuitously, we typically have less surgery performed on Christmas Day and New Year's Day and so on because our staff are taking well-needed vacations and they're with their families. So over the Christmas break, we tend to have a little bit more flexibility with the inpatient beds. And that helps us a little bit with patients with respiratory illness as well.
And really, I don't have much to add other than the fact that we've seen a huge increase in the number of doctors and nurses that are available in the workforce. As Minister Jones indicated earlier, we have the most physicians that we've ever seen in the province with over 13,674 doctors compared to 2018, 2019, which was at 10,600. So we do have a strong workforce that can deal with these added increases. Thank you.
Yeah, if I could just add two other things we're doing on the front end. We're trying to divert patients directly to other supports that may better serve them during this busy period. So if we've got people experiencing homelessness or people who require mental health and addictions related care, we are trying to directly divert them to that care as opposed to some period of stay in an emergency department. On the back end, I've already referenced that Minister Nixon and his team are every day moving alternate level of care patients to more appropriate care settings. Most of those, many of those to continuing care. And then there was some mention of surgical cancellation in the question. That has not occurred as of yet. Dr. Jameson, any update on that?
As we currently forecast things, that's not part of our plans.
Okay, well, thank you. Mark, do you have a follow-up question?
Yeah, really quick follow-up just on the immunization rates. Immunization rates for influenza and COVID, they've been dropping in the recent years here. The only other question I have is, what do you say to the doctors on the front lines that are saying that, that there's been a failure to promote public health and vaccination right now? Just any concerns on that that you'd like to address? This one's for
I believe that wouldn't be for myself. What we're seeing, in fact, is on influenza, is that 97% of the number of individuals that received the influenza vaccine last year have already received it this year. So whether they're the same people or other people, it's hard to say, but 97% have of that overall number have received their influenza vaccine this year. That being said, as I said earlier, it's not a great match to the current strains that are prevalent, but it is still worth getting because it does lessen the severity and can keep you out of hospital. We've spent over $500,000 already. We're going to continue to make sure that we have a very strong, robust reach out to the public in many forms. We continue to promote both the COVID vaccine and the targeted approach, which was recommended through NACI, which is the National Advisory Committee on Immunization. And of course, we're continuing with the program on RSV as we have in previous years. So I would say that we're continuing to make sure that we have a very strong, robust immunization program for Albertans to take part in, but it's up to Albertans to choose to make those decisions that are right for themselves and their families. Not sure if Dr. Sutor would like to add anything to that.
Yeah, thank you, Minister LaGrange. And it's an excellent question. So it is encouraging the uptake of the influenza vaccine at this point, very similar to last year. I think what's unique this year, and when we see more hospitalizations, is when we have the predominant strain being influenza A, H3N2. And historically, we can see the impact on young ones and seniors and those with chronic medical conditions are more impacted with this strain. And that is the one that's predominant and that we've also read about in other jurisdictions in the UK, et cetera. So that it's this strain that creates more and also more complications for individuals who are infected with this. So these are these years that when we see these peaks and impact on our acute care setting. What's also unique about this year, as Minister LaGrange said, there's one of the strains. There's 3 different strains in the vaccine. So one of the strains has slightly changed a little bit. The vaccine is still effective, perhaps a little bit less effective for adults and seniors than otherwise. But it is very effective for the influenza B and the influenza A H1N1 component of the vaccine. All 3 strains are actually circulating. So if you've had influenza A, H3N2, you may still get influenza B or influenza A H1N1. So the vaccine actually prevents you from getting 3 different influenza diseases in a season.
Thank you very much. We have time for one more set of questions, and we'll go to Cindy Tran.
Hi, thanks so much for taking my question. I wanted to follow up on the discussion of vaccines. So I've heard from experts who are saying vaccine hesitancy is at an all-time high. We look at the vaccine administration for the influenza, and it's getting lower every year, and we have seen a population increase. So I want to know what you're doing to target those areas in Alberta where vaccine hesitancy is high and there's not a high vaccine intake.
Well, we're continuing to reach out and by various means, whether it's social media, whether it's print, newspapers, TV ads. We're continuing to reach out directly through our public health officials. I know I'll turn it over to Dr. Sotar very soon here because I know she was on the ground working through the measles that we saw, the increase that we saw across the whole province, but we saw that right across Canada as well. And while vaccine hesitancy is real post-COVID, we are making sure that we can reach as many people in a way that they can accept and understand. Like we have taken many of our products and translated them into at least 14 languages, particularly around the measles. There have been phone calls made directly to parents of children that would be in the right age category. So by any means and all means, we have to reach out to people. But it is going to take a while for not just Alberta, but right across Canada and globally to overcome that vaccine hesitancy. And Dr. Sutarp, if you'd like to add anything to that.
Yeah, thank you, Minister LaGrange. And it is an excellent question. I've spent, over 30 years in medicine, and most of this in rural communities. And it's important to build those trusting relationships. And sometimes there's challenges with trust, and really to be aware who's in your community and who the local leaders are, and then also how to communicate, understand what the concerns are. So we know, as Minister LaGrange said, there are public health experts, including medical officer of health, but also our public health nurses and others who are in our communities discussing and working with and listening to the needs, the concerns, etc. And we have across the province also models. We heard about social workers being in emergency departments. In public health, we often use community health reps. So we have individuals from certain ethno-religious communities or other communities or Indigenous communities who are our ears and eyes and our bridges to the communities to really understand the concerns and the needs. Access, obviously, is one of the big aspects of a vaccine. So there are many strategies, many strategies across the province to offer access, and access also to some of the communities and in ways that is acceptable and culturally safe for them.
Thank you. And for my follow-up, I think it might also be best directed to Dr. Vivian, but we talk about measles. We have seen a number of these cases concentrated in the South. One, I'm hoping you're able to talk about your work in the South and what you've done to help with that outbreak there. And two, we currently have no active cases. However, there are concerns that because there's been such a resurgence in measles, that mumps and rubella cases will also come up too. So hoping you can comment on that.
Yeah, indeed. When one looks at the interactive health data application that you can just look at with the immunization coverage rate for childhood immunization, for example, you can see unique pockets across the province. And there's definitely a heterogeneity between communities. And even when you dig deeper, between schools of immunization uptake. And it's not a far stretch when you look at a map where our diseases are of vaccine preventable disease, it is in those communities. So how did we get there, and how do we work with the communities and minimize the impact of disease and disease outcomes? And a lot of this work is, as I said before, as frontline public health clinicians, working with our communities, building trust, working with the local leaders, understanding what the challenges are, and actually bringing awareness of what these diseases are. In many communities, we haven't had large outbreaks of measles or rubella for many years. I think the last case of rubella in the South were in 1996. And so to bring awareness of the impact of the disease and ways to prevent transmission. As I mentioned earlier, everybody owns public health, and individuals and family, how do we as communities, as individuals, as faith-based organizations or schools protect the most vulnerable and those who are not able to have protection by immunization yet. So a lot of that work is ongoing. And I mean, I have boots on the grounds. I go to different small rural communities and just listen and be there. And there's a lot of misunderstanding and often mistrust. So I think that is really the essence where we're at, and where I'm very encouraged with the entire public health refocusing and that integration of public health into the primary care system. Thank you.
Thank you very much. We actually have time for one more question, and we'll go to Matthew Skase.
Hi, thanks for taking my questions. This one's for Minister LaGrange. we've reporting back from a few months ago that Mr. Jaffe, the predecessor, clashed with government over how to address the public over measles. He urged more communications. So unless you dispute that reporting, will the new CMOH have more freedom to communicate with the public as she feels appropriate?
We always supported our Chief Medical Officer of Health to go out and collaborate and work with and address the public. And I will continue to support CMOH, as will my whole department and my ministry. We will want to make sure that, you know, Mark Jaffe, when he was the CMOH, we worked collaboratively. He also recognized that there were pockets of, as was indicated earlier by Dr. Sutar, pockets of under-immunized or unimmunized individuals in the province, and we needed to address it. And that's what we did. We worked collaboratively together. Part of it is communication and advising, and then getting out to the public. So we had a very robust campaign. In fact, before school even ended last spring, summer, we had communication going out to all of the parents to make sure that they were checking their children's immunization in case they got behind while they were, through COVID. There was many opportunities to go into various communities, and as I indicated earlier, we translated much needed information into at least 14 languages. People were making direct phone calls. Public health officials were making direct phone calls to parents and to people in high-risk categories. So that communication was very good. I really appreciated Dr. Jaffe's work, and we thanked him for it. And he took on a lot during his interim period, and we really appreciated the work that he did.
Thank you.
I think if I can just add to that point, what I also saw, just so as an aside, as perhaps a point of interest, is that our communities have also provide communication. So if there is a disease prevention, there was communication. When we heard about measles starting in New Brunswick, there was already internal communication within communities and from leaders within some of our cultural communities actually informing of measles. That people would reach out in South Zone, as the medical officer help, would reach out to me. What resources? Where can we send individuals in our community, in our school, or in our church to see resources, to access evidence-informed resources? So I just wanted to point out there is other information being shared by our community leaders.
Thank you for that. Appreciate that. This is an unrelated follow-up to Dr. Jamieson, I believe. I'm wondering if you could provide some specific data on how the influenza is impacting hospitals right now, either admissions to intensive care, how much overcapacity certain hospitals are, or anything like that.
The load of patients we have in an intensive care department at any given time varies day to day, even hour to hour. So I don't have at the top of my mind specific numbers related to ICU admissions. We do track hospital admissions related to influenza, and those are reported as by the ministry. So the question in terms of the availability of those reports, I think, would be to Minister Jones. I think the main point that people need to understand is that influenza, for many people, is a benign illness, but it can be very severe for people who have other heart or lung conditions, for the very young, or for the elderly, or for people whose immune systems aren't working well. And that's a big part of what we do during influenza season, is help people with those severe conditions. And certainly there is a surge in the number of patients who need ICU admission, and unfortunately the number of people who pass away.
Yeah, Minister Jones here. So the latest data I have as of December 18th is we had around 650 patients in hospital with influenza, but 147 with COVID-19 and 29 with RSV. And again, as mentioned earlier, we expect peak hospitalizations in later December to early January. And for influenza, the current projections are somewhere around 750 influenza hospitalizations. So that should give you some numbers.
Thank you.
Okay, we will now move to Felix Gagne.
All right. First of all, I'm Felix from Radio-Canada. Seems like this season of influenza reach cases high in Alberta. What would have been done? What could have been done to prevent that? For Chief Medical Officer and Minister Lagrange, please.
Well, I'll start by saying I don't know that anything could be done unless people hunker down into their homes and just stay there throughout all of influenza season. People are traveling. They're traveling not just within Alberta, they're traveling across Canada and globally. And the flu is very active right around the world, as you would hear in media reports globally that the UK is extremely hard hit this year in particular. As I said, and Dr. Sutarp has said, it is a particularly virulent strain that is not well matched to the vaccine that is out there, particularly in Alberta, the one that was promoted and given to us to disperse. So I would say that we're doing everything we can, and we started preparing as we do every year very early, making sure that we had the right workforce, the right number of beds available, etc. But I'll turn it over to Dr. Sutarp to see if there's anything more beyond what we're doing.
Thank you so much. And this whole prevention and preparedness is so fundamentally important. So public health and works with all our partners, especially our seniors partners, our contracted facilities, unhoused shelter populations, etc., in the early summer already to plan for respiratory season. So it is reviewing on outbreaks. What if you have two individuals with a fever and a new cough in a congregate type of seniors facility? What is supposed to happen there? So a lot of education and resources are created and support for all of these types of facilities. Similarly for hospitals. So to prevent, obviously, large outbreaks in these facilities. If there's large outbreaks, ultimately, this would impact length of hospital stay and the movement of individuals from their place of residence to acute care. So there's a lot of work that goes on. Every year, the outbreak management guidelines are tweaked and supported. There are things, for example, if individuals have influenza and there's an outbreak declared in a long-term care facility, there are already orders signed, prescription orders, for example, for a very vulnerable population who may need an antiviral to prevent them from getting disease if influenza is on their nursing unit or on their resident, the unit where they reside. Those are just some examples of all the work that happens months ahead. Just a comment on, can we prevent waves? Influenza is here every year. It's seasonal. COVID hasn't truly reached a seasonal pattern yet, which is interesting. And when these peaks occur are difficult to tell. And secondly, it's difficult to project like right away which strain is going to be the predominant strain. So which with influenza H3N2 being the predominant strain right now, we can't project always if it's H1N1, for example, or this strain. And as I said previously, this strain is always more impactful in disease impact and complications for those most vulnerable.
Isn't like the vaccine not being the best match to the current strain, like the current strain, a common thing, like a thing happening years after years, and could like even when that happened, could better immunization rate could help not have that much cases?
Yeah, so what happens for influenza vaccines, sort of there's projections of which strains will be dominant, and which types of influenza. And that's how the vaccines are based 6 months ahead. Sometimes if there's slight different change, like slight alterations of the virus, because it changes so quickly over time, that may impact the vaccine effectiveness. We don't usually know till early in the new year's, usually, as far as the exact vaccine effectiveness. Right now, the projections are there is still protection, and especially protection for individuals who are most vulnerable to prevent severe illness, hospitalization, and severe outcomes.
Thank you very much. That will end our conference for today. If you have any follow-up questions, please feel free to email me with my information at the bottom of the news release. Thank you very much.